I see that it says this session is being recorded.
Hello, everyone. Thank you so much for bearing with us with the technical difficulties. My name is Melissa Barron, and I am a program manager at the Center to Advance Palliative Care, which sponsors getpalliativecare.org. Welcome to today's webinar, How to Manage Shortness of Breath and Improve Your Quality of Life, with Dr. Tara Lieberman. Thank you for joining today. Before we begin, a few things to note. If you are having any technical difficulties, like we just did, please make sure to dial into the number on the right side of the screen. It should be under the audio section of your GoToWebinar panel. If you have any questions that you would like answered as we go through the session, please just type them into the question section of your panel and it'll be addressed during the question and answer portion toward the end of today's webinar. I'm very excited to now turn it over to Dr. Tara Lieberman.
Thank you, Melissa. My name is Dr. Tara Lieberman. I'm an internist who specializes in geriatrics and palliative medicine. I am located actually in Long Island right now, where there's a lot of bad weather going on, but I'm happy to be here today to talk about this topic, which is how to manage shortness of breath and improve your quality of life. And thank you for joining me today. Next. So to start, I just wanted to briefly discuss what we will cover today. What is shortness of breath and its causes and triggers? Where palliative care may be providing you some relief, how to manage shortness of breath and getting it under control, some frequently answered questions, and things that you're questioning amongst yourselves. And we're here happy to help you in any way we possibly can. Next. So what is shortness of breath? And to believe me, people have many, many different definitions of this. It's really the experience of breathing discomfort that feels like, and some people say like breathlessness, the smothering feeling or suffocation, some air hunger. And most of the time, it really just impacts your ability to function. Many people have different ways of describing shortness of breath, and it may be different for each individual. So these terms may not be exactly what you're feeling, but you just may feel as though you have a loss of air or you need support in how to gain it back. And that's what we're going to talk about today. Next. There we go. So there are many causes of shortness of breath. And I find that physicians and practitioners may not even recognize one's shortness of breath because you may not look like you're short of breath. And what's important is that somebody asks the questions or you tell them that you're feeling this shortness of breath or the feeling of air hunger or the commonality of what we discussed before. Because there are many, many causes of shortness of breath. And I'm going to describe a few here, but there are many more that I haven't listed, and probably we can list many, many more going forward. But a lot of them have to do with lung diseases, whether you have asthma or COPD. Some people may call this emphysema. There might be things like idiopathic pulmonary fibrosis, where your lungs have some scarring. There might be things like bronchiectasis, where you might have had chronic infections. There are many different lung diseases that can cause people to feel short of breath. What's also interesting is that people with heart failure or problems with their heart function or pumping can also feel short of breath as well. And that may be because of the backup of fluid that may end up in their lungs due to the heart not pumping as well. There are other things like cancer, where it may be a primary cancer what's in your lung or a cancer that has spread to your lung that may cause someone to feel short of breath. And then things that we don't think about as often, but things like liver disease or kidney disease, where fluid may be building up in other parts of your body, whether it's in your stomach or in your arms. You may feel the sensation of not being able to breathe because of these diseases as well. Next. So many things trigger the feeling of shortness of breath, and everybody is individual, and we have to be mindful of that. Some would say that it's just the actual getting up and walking. Patients who are sitting in bed and need to get up to go to the bathroom, they may feel this short of breath, which is what we would think might be easy, but for some may be very hard. Just up and going up a flight of stairs, a couple steps themselves may trigger the feeling of shortness of breath. Many people tell me that the emotional stress may cause shortness of breath. Things like anxiety, when they're involved in some type of experience that might cause them to be anxious or depressed or irritated or angry, a feel of panic, maybe some fear. This may be a trigger that can cause someone to be short of breath. I also hear often that there are irritants. One of my favorite stories, or not so favorite stories, was when one of my patients who did have underlying lung disease from emphysema had gotten her hair colored, and the fumes itself caused her to feel very short of breath. So environmental elements can cause one to be triggered into this feeling. Things like dust, temperature, whether you go out into the cold or if you walk into the heat, people feel this different feeling of shortness of breath. If you have been enduring some pain, whether it's back pain or an acute event like a fracture of some sort, that may be hard for someone to take deep breaths because of that feeling of pain in their body and being able to really get relief. And on top of it, there might be some types of infections or fluid on the lungs. And what we talk about less, and which is really something that's very, very common, is just the practical issues of family life or financial issues that may cause people to be overwhelmed and anxious and can cause one to be extremely short of breath. Next. So this is where palliative care comes in, and I'm going to talk a little bit about how we can help you with these symptoms. Next. So what is palliative care? Well, palliative care is a specialized medical care for people with a serious illness. This type of care is focused on providing relief from the symptoms and stress of a serious illness. The goal is to improve quality of life for both the patient and the family. Palliative care is provided by a specially trained team of doctors, nurses, and other specialists who work together with your other doctors to provide an extra layer of support. It is important at any age and at any stage in an illness, and it can be provided along with curative treatment. Next. There's, unfortunately, public awareness of palliative care is low. In fact, when doing some studies, we have seen that 70% of patients and their families are not knowledgeable at all how palliative care can help somebody. Some people, we have been increasing these numbers with time, but we're happy to have a lecture like this today to increase awareness and knowledge of how a palliative care physician or team can support patients and their families through symptom management. Next. In fact, once informed about palliative care, 92% would be likely to consider palliative care for themselves or their families, whereas 92% believe patients should have access to palliative care nationwide, and 95% said patient and family education regarding palliative care as part of a treatment is important. And we believe that as well, and that's why today we're having this lecture in order to educate and improve patient and families' symptoms and goals. Next. So how can palliative care improve shortness of breath? And that's a very big question. So today we're going to talk about how we can help control the symptoms and stress of an illness while improving quality of life. Palliative care is appropriate for those with shortness of breath because this symptom is often associated with illnesses that palliative care treats. Next. So how do we do this in a stepwise approach? And first, I always want to start with identify what we're feeling. Tell your medical professional if you feel short of breath, because like I said in the beginning, they may not know that you're short of breath because you may not look short of breath. I find myself asking every one of my patients that part of their initial assessment is, are you feeling short of breath or have you felt short of breath in the last month? I then would have them evaluate or understand what the reason for the cause of shortness of breath. And we went through many of these reasons in the past, in the part of this lecture, about what might be a reason, and there are many more that we haven't even discussed. And then the next step is to treat. You may have different approaches ranging from medicines, procedures, things that you can do on your own, things that you can do combined, and we have to figure out how we can improve the management of your shortness of breath. Next. So always tell your medical professional what triggers or causes your shortness of breath, right? If you're walking outside and the cold hits you and you feel short of breath, if you get up and walk from the bed to the bathroom and that causes you short of breath, if you walk up a flight of stairs, that's causing you to feel this feeling of air hunger, you should answer and give answers of what is causing this feeling. Because we need to determine if the shortness of breath is due to a primary medical cause or if it's because of one of the triggers that is happening around you. Next. Key evaluation strategies are diagnosing the cause, and our doctors that you're working with can help through this, because we want to make sure that there's something that's possibly reversible, like an infection or fluid on your lungs that can be easily treated. We want to be able to manage these symptoms by identifying and addressing relating symptoms. Next. So what are some of these options that we work with closely as a palliative care team with your physicians to offer in order to provide patients and their loved ones shortness of breath? But always, before you have these conversations with your provider, because it's important to talk about the risks and benefits for you and your individual cases. So some options may include things like prescription medications, whether it be in an antibiotic or a nebulizer or some type of medication that might provide you with relief of your symptom. Some people will require a supplemental oxygen, and this is something that is individual and something that should be spoken to with your provider. There may be a procedure that needs to be done where they need to take the fluid off, or there's some type of way that a medical procedure can help people feel that relief go away. There are an increasing amount of complementary and alternative approaches that we tend to talk about and work with in order to have patients and families find in order to decrease some of their symptoms. And then there's that ability once upon yourself to change the environment, change your behavior, so that we don't have these cycles of being short of breath and having triggers that can improve, and so that we want to improve your quality of life that you yourselves can work on. Next. So some of the medicines we talked about briefly are things like inhalers or nebulizers, and these can help improve patients' feelings of shortness of breath or air hunger. And they're individualized for different diseases that doctors or practitioners will prescribe. There may be an infection of which an antibiotic may be helpful. This may be a short course, or it may even be a long course, depending on what individual patients might require. Sometimes a diuretic or a medication that will get rid of fluid may help, and this would help in somebody who has something like heart failure, where they need to get rid of the fluid in order to improve their ability to take deeper breaths and feeling less air hunger. And in some cases, opioids are a choice that can be utilized to help patients feel less short of breath and be able to take deeper breaths so that they can function in the way that they are able to improve their quality of life. And last, there's also things like anxiety meds that can provide the decrease of anxiety or those triggers that we talked about in the beginning that can provide patients the relief that they're seeking. Next. So who would need supplemental oxygen, and how does supplemental oxygen come? And this needs to really be prescribed by a practitioner. So you need to speak individually, because there are guidelines that are in each different areas of what is needed for oxygen. And there are different devices out there. There are so many more devices than there have ever been before. Things like just the simple nasal cannula that we see patients wearing, that they may require a tank to carry around with them, or a tank in their home to provide them with the oxygen via this device. Or there are other things like machines, including CPAPs and BiPAPs, that can help patients improve their ability to get rid of some of the feeling of breathlessness. And each of this is individualized and can be spoken to with your practitioner. And some of these are very helpful, and other people don't find them very helpful and can cause more discomfort. And that is a conversation that also should be held, because in the end, this is really about making sure that your wellness and that your quality is improved. Next. When do we consider an opioid? And there are a lot of questions about this. And I find that this is one of the more supportive medications that we see providing to patients with lung diseases or patients with breathlessness, because we have this fear that it could cause breathlessness to be decreased, that may stop breathing. But the reality of this is not a real truth. That at small doses of short-acting opioids, it actually improves patients' feeling of air hunger, gets that gone, relieved, and improves their quality, and allows them to be able to get up and do the things that they weren't able to be done before. And that is something that we partner with our the primary physician in order to understand the risks and benefits with their individuals. And we always understand that this is something that may be started slow and maybe it needs to be increased with time, but each patient is individualized. Next. And my saying, of which I always see my patients, is when you're short of breath, you're anxious, and when you're anxious and you're short of breath. There's this vicious cycle that unfortunately patients may feel when they become short of breath. And it's natural to feel this way. And I always try to reassure my patients that this is something, but we need to figure out what's triggering it and how do we control this, so that you can break this cycle. And sometimes a low-dose anxiety medication may help. And sometimes it needs to be scheduled, because we don't want to wait until that occurs. We want it to be, there so that we don't get into a cycle and into this fear of being breathless. And so, again, I'm always in the room saying, when you're anxious, you're short of breath, and when you're short of breath, you're anxious, which is extremely normal and understanding, because it's a scary feeling and uncomfortable feeling. And so the goal is really to just break this cycle. Next. There are also sometimes, medically speaking, needing for procedures. And a lot of this can be around things like fluid. There may be fluid in the lung from whether it's a heart failure or a fluid from a cancer, but there may be some fluid in the lung that can be removed by a practitioner. And this simple procedure may improve someone's breathlessness or shortness of breath. Usually it is a very simple procedure and causes minimum harm, but can really be a great improvement to somebody's quality of life, because that simple removal will allow them to breathe easier and be able to do the things that they enjoy. There's also things like blood transfusions. If a patient is very anemic, they may feel that with a blood transfusion, this may improve the ability for them to breathe, because it'll improve the pumping of the blood through their bloodstream into their lungs. And so that might be something as well that might help somebody's quality while they're being treated. Next. And more, we are learning that complementary and alternative medicines can help. Things like yoga, being able to practice this mind-body experience with things like Tai Chi, breathing exercises that can be done on an individual basis in your own home with time. These things can really suppress somebody's feeling of air hunger or breathlessness. There are things like mindfulness and meditation. I encourage my patients to think about exploring different ways of thinking about how they can control and take this upon themselves to really be in control of their shortness of breath. And things like mindfulness and meditation can really take them into another world. We utilize a holistic nurse who sometimes can teach these approaches, and they are very available in many areas around the country. Proven literature around acupuncture and acupressure can also help patients understand the relationship to this medical practice, increasing patients' ability to breathe more comfortably and for hopefully longer periods of time. But always, because these things are not standard in traditional Western medicine, we always ask you to consult your doctor prior to use because we want to make sure that there's nothing that would be contraindicated. Next. There's also a lot of behavioral and environmental approaches. So what I find is walking to a room that's so hot that really can cause patients to feel very overwhelmed and maybe even suffocating because of the heat. So we encourage them to have to make the room cool. Maybe have an electric fan or an air conditioner. My favorite thing is to tell patients to buy those little handheld air fans and put them right now at their bedside, because that seems to really improve patients' feeling of the breathlessness. We also encourage people to sort of focus on things that are cool by mouth, eating cooler foods and beverages. That hot soups may make somebody feel more uncomfortable and more breathless. And the way we sit, which is interesting, we all tend to slouch. It's unfortunate our posture is like this, but if we sit upright, we sit in a chair, we sit where our backs are to the back of our beds or chairs, we breathe better because we allow for the lungs to be opened and aerated and allow for people to take deeper breaths. And please avoid the environmental irritants, especially like my lovely young lady who decides to get her hair colored. Things of that can really irritate people. So, avoiding being in a place where there's construction being done, where there might be dust, where it might be a warm, hot environment. Things of that might be very helpful in trying to decrease these triggers. And what's also very interesting is being in a claustrophobic setting, being in a very confined setting with multiple people may also trigger this feeling of anxiety or shortness of breath. And so trying to sort of steer away from this might improve your quality and improve the ability to stop this breathlessness. And what's counterintuitive is that people think that if you do less, you will breathe better. But the reality is you need to exercise your lungs, exercise your body in order to get stronger and be able to improve the breathing that you're having. Next. So on that note, we need to stay active, right? We need to sort of get ourselves up, do the best that we can to, improve our physical activity or inactivity. We want to, maintain a sense of well-being, to enhance quality. I'm not saying that we should go run a mile or go on a treadmill, but I am saying that we should get up, move our bodies, take deep breaths, exercise, even go to your physician, your practitioner, and ask for things that you can do on a daily basis to just improve the ability to strengthen your body, strengthen your lungs, strengthen yourself. in order to decrease that feeling of breathlessness. Next. There are pulmonary rehab programs out there that you can find that may be effective to restore physical and psychological function. And so I really encourage you to speak with your practitioners and your communities to see where these programs are in order to engage yourself in them. But always start small, because even the smallest thing can really count. Again, I'm not asking for a marathon, but just small baby steps in order to get you up and moving and creating an environment that's important for your lungs and for you to be able to breathe better. And try to make it fun. There are a lot of wonderful things out there that can help you improve your quality of life without being bored, because nobody wants to do stuff that's not going to be enjoyable, right? Next. And also really making sure we're eating well, right? We want to make sure that we don't lose weight. It is very common for patients with breathlessness, shortness of breath, air hunger to limit their intake because it takes longer for them to eat between their ability to breathe. So we want to be mindful of this. We don't want to lose our weight. We want to really keep our nutrition up, keep our ability to eat up. So we always tell trying small meals many times a day. Nobody really can eat a big meal. It's really important to eat small, tiny little meals a day, spaced out. Even little supplements, drinks of that sort. If this is something that you're very interested in and you might have some questions about what types of foods you want to try, a dietitian would may be helpful, and finding from your practitioner, if there's somebody who's in particular, they're specific to the type of condition you have, they may be able to steer you to the right foods and how to eat them, how to prepare them, and how to be a part of your daily activity. Next. So in summary, it's really a stepwise approach, right? It's individually people have a different definition of what their shortness of breath is, but it can't be identified without it being talked to with your physician, right? Your practitioners. So we need to first educate ourselves, right? We have to educate not only ourselves, we have to educate our practitioners. We have to think about how and different behaviors, how we can make take it upon ourselves to change the things around us, the environment, the triggers that may affect our breathlessness. We have to improve our physical being. We need to get up. We need to exercise. And we need to utilize medications appropriately in order to allow us to do all these very good things so that we can improve our quality of life. Next. So I always like to think of this as a plan, right? So first assess the situation, figure out what's been going on, work with your practitioner, have a plan. Think about this plan. Make sure that not only you know about the plan, but your caregivers know about the plan so that you can work together. Especially when you're breathless, sometimes you forget what the plan is, and it's always wonderful to have somebody who's right there with you who can help you, remind you about how to actually do this. Because the next step is to actually do this, do your plan, take it in control, be a part of how we can stop the cycle, and then monitor after it's all done, see how you've done it, and review with yourself, review with your caretaker, review with your family, review with your practitioner, because we need to then start this process all over again and assess the situation, plan, do. And this is an ongoing thing that can always be identified, modified, and changed. And as a partner with your physician, we can work on how we can improve your quality so that you have less episodes of breathlessness or shortness of breath. Next. So briefly, what are some frequently asked questions about palliative care? Next. So ultimately, the goal of palliative care is to improve your quality of life. And I've said that many times throughout this program, that the way that we improve quality of life is by partnering with your practitioners, your patient, yourselves, and your family or caregivers in order to utilize the right resources out there to help you have less breathlessness and thus improve quality of life. Next. So really, who provides palliative care? Well, palliative care is provided by a team of palliative specialists who may include doctors, nurses, or other practitioners. It can be provided in various places, including hospitals, outpatient clinics, and at home. Next. So when do you ask for this referral? So if you're suffering with unrelieved shortness of breath or other symptoms or stress due to your illness or its treatment for that matter, you may want to ask your doctor for a palliative care referral. Explain to you that the benefit is an extra layer of support that we can work together to help improve the quality of you and your family. The patient, family, or doctor can find a local team, if they don't know of one, on the provider directory on getpalliativecare.org. Next. And there are many resources out there to learn more about palliative care, including the website www.getpalliativecare.org. This is a very clear and comprehensive website. It provides a definition, 5-question self-assessment to understand if it's right for you, information how to get it, with tips on how to talk to your doctor about it. It gives you real stories in our free podcasts and includes a provider directory, which is searchable by state and now with community-based listings. So download a handout about what you should know. Next. So thank you so much for listening to my fun shortness of breath. Are there any questions? Sorry.
Yeah, thank you so much, Dr. Lieberman. We really appreciate your time with this presentation and answering everyone's questions. So we're now at a point where we're going to begin our Q&A section. And we already have some great questions coming through, but if you have any additional questions in the next 20 minutes or so, please feel free to put it in the question section and we'll make sure to address it. So our first question is coming in, and again, as I said, in the chat function, we're not going to be listing anyone's names just to protect your privacy. So one question that we received is, what if my doctor does not understand palliative care and won't refer me?
So, I mean, I think that the last few slides that talked about www.getpalliativecare.com really describes what palliative care. It might even be a good opportunity to refer your physician to that as well, so that they understand that palliative care is a supportive program that works in conjunction with them to help improve their quality. They could even consider, having them reach out to somebody locally so that they can discuss what's been going on and how they may be of help. This may make it more personable and might be able to understand that, there is a role for palliative care with patients who might have shortness of breath that could be helpful within their situation. So partnership, how do we get, encouraging them to partner is basically the answer I would have to say.
Okay, thank you. Someone else has asked, doesn't palliative care include social workers and spiritual care providers?
Yes, in many programs, there are social workers who work closely with the practitioners, and this is really helpful in a lot of the realms, especially in this where possibly there might be an outside stressor, like an anxiety proponent or financial or family members that might be triggering the shortness of breath, and they're very helpful in sort of analyzing and working with you on how to minimize these triggers and gather how you can be in control and how you can help give this information to your loved ones. And also you asked about a chaplain. In many programs there are chaplains involved, and a lot of this has spiritual component, and there's someone to talk to about how this feeling may be related to their spirituality. And so we always encourage everyone to sort of think of all these different domains when thinking about how to treat somebody with a symptom like shortness of breath in a multifactorial way. So including the social worker and chaplain is also very important.
So my doctor, as someone says, my doctor does try to address the different symptoms and problems, but there still are issues. If I've asked for a referral to palliative care, well, if I do ask for a referral to palliative care, won't my doctor get defensive or feel like I don't have confidence in her care?
So I think that's always, again, a concern, because we never want to offend our physicians. We have good relationships with them and we work closely. I think this is just an extra layer of support. And again, I think having them discuss or contact a palliative care provider might help them understand where they can help each other, figure out how to better help the patient and the family. It's just complex. Shortness of breath is extremely complex, and I've come to realize in my practice that I can't always do this on my own, that I need someone else to help me work together to improve my patient and their family's quality of life and improve their symptoms. So I think when thinking about it in that terms and just taking it as a partner, just an added layer, I think that might help physicians understand why it's not offending them, but just sort of helping them, or creating a partnership.
If a patient has a chronic disease, is there a particular time when palliative care should be involved, and can it be utilized before the patient starts feeling short of breath?
So any chronic disease, a patient can look for a palliative care provider at any point during their diagnosis. And honestly, to be frank, it actually improves when you ask somebody before the symptoms develop, because then you have a relationship with that palliative care provider. And when symptoms do arise, they can handle them and work with your doctors quickly and can sort of keep these symptoms under control as soon as possible without waiting until they get out of control. And I think that would be very beneficial, of getting involved earlier, getting involved in the beginning of your diagnosis, so that you have that resource in your back pocket, so that you don't have to be panicking and finding somebody to help when it comes to fruition. So yeah, I would say at beginning.
I just looked on the provider directory and there's no palliative care in my area. Does that mean I'm out of luck? And then also, I guess we could pair this with another question which came through. In certain counties in Florida, there are no teams and only one inpatient doctor. What should people looking for palliative care do? So really, this is about not being sure if there's resources, and what do people do in that situation?
I think that I'm going to defer to Lisa. I think that the website, the getpalliative.org, could be helpful, but are there other ways to sort of help navigate this?
I think the website is the best resource, and it's getpalliativecare.org. I just want to differentiate from a .com, but it's .org. But the website is easy to navigate, and it will lead you to the answers to those things. So from the quiz, the self-assessment quiz, to the provider directory, to the section on how to talk to your doctor, and all the talking points for the doctor, including insights. I think everything's there. I don't know of a better resource for this.
My other suggestion would be this: one of them said that there was a doctor in an inpatient, but not in the community. Always reach out to that doctor in the inpatient, because they may know somebody who could help. Very resourceful in that way.
And that's where the provider directory comes in on getpalliativecare.org too, so that you can easily see who's in your area by zip code, by city, by state, and then you can reach out to them for exactly that reason.
Great, thank you.
Okay, so we have a bunch of more questions, one of which is, how is this kind of medical care covered by insurance? Will I have to pay for it directly?
So it's like any other practitioner that you would see. It's covered by your insurance. And so it would be just like any other regular visit you would see, whether it's in the community or in the hospital. It's there for you. The medications are all there as any other referral would be in the community. There are, and then you'd have to individually look into your insurances about things like exercise, rehabs, and acupuncture, and those are all individually carriers by your insurance. That may be something out of pocket, but that's individual basis on insurance companies. Some will cover it and some won't. But palliative care in general is covered by all insurance companies.
Okay, thank you so much. Can I contact a palliative care doctor myself, or does it have to be through a referral through another doctor?
No, you can definitely call yourself, and they will help navigate the system for you if need be. It might be helpful to contact your primary doctor to let them know that that you're doing this, or that they may want to be involved as well. But majority of palliative care doctors are happy to navigate and help you figure out what the best care for you will be in your community.
Great, so many awesome questions coming through. We have a question. Someone says, my dad has COPD and is very breathless. He gets very anxious about leaving the house despite having portable oxygen. Do you have any tips to help him get out and about?
This might be a very good referral for a community-based palliative care. Either they can come to your home, or there's some type of physician in your community that maybe he'd be willing to go to, because I think a lot of the things that we talked about today are ways in which the palliative care physician or practitioner would be able to sort of improve the anxiety around leaving the home. Because like I said, when people are anxious, they're breathless, and when the breathless is anxious, and when they leave, sometimes that feeling of leaving, they feel insecure. And so I think this team approach with a social worker and practitioner might help work with the primary doctor in order to figure out what these triggers are, figure out how we can treat them, and then figure out how we can get him out into the community so that he can enjoy a better quality of life.
Another question coming in. What if I've tried many of the things that you've described for symptoms and like solutions, and I still have the symptoms?
I think that my question would be then to have you worked with a palliative care team. A lot of the things that were provided by traditional doctors may need to be multiple things at the same time. They might need to be in conjunction with some types of other therapies. I think the partnership is really important of the palliative care team and the primary physician, because they can work with each other to figure out what those triggers are for you specifically, because some of these things may be helpful for you, and there may be other things that I didn't speak about today that might be available in order to help you relieve your breathlessness. So I would encourage you, even despite maybe talking about all these things, maybe still trying to reach out to a palliative care physician in conjunction with your practitioner in order to see if there are other opportunities out there.
Someone said, I would like my mother to investigate palliative care, but there's a stereotype that palliative care is synonymous with end-of-life care. Do you have any tips to fight this stigma? Because I know that it's not the same.
So I think one thing is to have her listen to this talk today. I think that really emphasizing palliative care as quality of life care. I think the website, getpalliativecare.org, is also a great resource for them to learn and talk about it. I think also just meeting a palliative care team will really recognize that patients are really, that the goal is really to live a good quality of life with the serious illness that they have. And there is less focus on end-of-life care. So I think it's really important to understand that there is a difference and that we have a lot of opportunity to work on that.
And this is Lisa Morgan. I'm here in the background with Dr. Lieberman. I'm with the Center to Advance Palliative Care. And I would just add to that, because this is a frequently asked question, I would add to that the main point to make with anyone who has this misconception is that palliative care is based on need. It is not based on prognosis. So you can have it from the point of diagnosis anytime in your illness, but it is based strictly on need. And that is the key takeaway, the key point to make.
Thank you,
Melissa?
Lisa and Dr. Lieberman.
Sorry.
Yes, hi. we have time for a couple of more questions, so please keep them coming through. Someone just sent, I've actually ended up in the hospital on many occasions due to breathing crises and other problems due to my disease, but I haven't been told about palliative care. As a doctor, does that surprise you?
I think, like in the beginning of this, it's less knowledgeable, and I think that's the point of having these conversations and getting out there. That you know, being an advocate and advocating for yourself about engaging a palliative care team member to help you with your symptoms is really important. I think recognizing that that physicians do have sometimes are not as quick to call because they are not as knowledgeable, and so once they are, then they seem to be really excited about it because they recognize how helpful they are in their care of their patient and the caregivers, and so then you see sort of a spiral effect of them working together more closely on many patients going forward. So I would encourage you to be that person to tell your doctor, I really would love a palliative care consult to be able to work closely with you so that I can improve the feeling of breathlessness and maybe decrease these hospitalizations.
Okay, does anyone else have another question for Dr. Lieberman before we go? If so, feel free to just put it in the Q&A section of your screen. And if not, we really appreciate everyone's time and hope that you have a wonderful day.
Thank you all so much.
Okay, thank you.
Alrighty, bye-bye.
Bye.